And also initiating a really good clean before you open up again, and especially focusing on touch points and using the right chemicals and the right wipes at the same time.
Okay, so there's an awful lot of detail in there. We've seen a draft that's gone out to most of the people watching this today, and what you'd really like is some feedback between now and next Wednesday, really. Yeah. Would that be fair to say?
That'll be fine. Yes, we've got a trained COVID support team now. You can put questions through to myself or Caroline and Martin. You can come to our COVID support team. We come and visit you in your premises and point you in the right directions, advise you, and hopefully, in many cases, say well done with what you've done so far.
Right. So there's an opportunity for people. I'm just trying to get it up onto my screen so we can show and share it with everyone. But we'll do that in just a moment's time. So the checklist goes through a safe opening checklist. Now, people will think we're on this already, particularly in the close contact. And I think we were talking before in the close contact services. That's an industry that's very used to dealing with hygiene. It's very used to disinfecting things. It's very used to using apparatus that they were making sure that everything from a comb and a pair of scissors to massage material and whatever is exactly as it should be, because that's how they operate. So in the main, they should have most of this done, shouldn't they?
I would have thought so, yes. And it would be silly little things that people may forget sometimes. Is checking your barbicide, which the barbers will use to clean their combs and the brushes, stuff like that. Make sure that's that's a fresh solution. Make sure if you've got an infrared or a ultraviolet system for cleaning your systems. Oh, can you hear me?
Yes, I can hear you.
Yeah, sorry. Yeah, make sure you've got your infrared system or your ultraviolet is working and the bulbs have been replaced. And what I've seen of this sector, it's very well looked after already. But just check everything's all right. Make sure you have the right amount of PPE. Make sure you have the right chemicals. And as I said before, if you're using any sort of virucidal or chemicals or wipes to clean surfaces, touch point surfaces, just try and make sure it's compliant with this number, EN 14476. You've got EN 14476. That is a proven European standard for virucidals that will kill viruses.
Okay. Hopefully, I was sharing the screen that you could see that we had the checklist up there, or what the checklist looks like at least. And that checklist there is the safe opening checklist and getting ready for that. I'm going to bring back in Martin on this, because Martin, this checklist is quite important in just getting people thinking along the right lines a week in advance and making sure they're not rushing around at last minute and they've got everything just prepped up exactly the way they should be.
Yeah, that's right. I think, as Mark's already said, it's meant to be a kind of an aid memoir, something to just start the kind of individual thinking. Obviously, it refers people to the wider guidelines and consider, making sure risk assessments have been up to date. I mean, I think guidelines, they're generic. They're kind of quite highbrow at times. But a number of the people on the call will obviously know the kind of individual intricacies and requirements of their own business. And looking towards that kind of wider planning and safety planning of those issues that are most relevant to your particular sector is really important. Again, I think one of the things to remember there as well is, if you're a business that does have some staff areas and different environments whereby your staff might break out to, whilst you might be doing a really great job of sanitizing some of those environments, sometimes when you then pull into back of house, and it's not atypical of broader professional groups, sometimes in healthcare as well, to kind of forget that, that when they're moving back into their coffee room, that, that they're washing their hands before they're kind of using that the surfaces are properly clean. I don't know, Mark and Caroline have probably got more examples of kind of where they found germs and muck in those environments than the front of house environments that are generally better catered for. So a reminder about looking after our staff and making sure that we don't drop our guard in those kind of environments is part of that guidance as well.
It's quite interesting, actually, Martin. That's an area that we have seen previously when it comes to retail, and I'm using that as an example because we've gone through this process with retail over the last week, and we're now moving to talk about with the close contact. And I've got 9 questions, so we're going to go to those in just a second. In terms of going through that process, it has been the coffee room, the cigarette break, the time when you're having your coffee break in between. When you're front of house, people tend to be good. When they go back of house, they tend to forget. That's been an interesting development that we didn't see last time, that we are seeing this time.
Yeah, I think it's not saying it always happens there, but I think it's in recognition, actually. We've all been doing our best to make it work and to ensure we're being able to protect both ourselves, the people we work with, and our customers. You know, and you know, that actually we need to extend that as far as possible. Our protections are there, but we do see slips in that environment, and then also you know, social moments when quite often, because we know people at work, we'll then meet them outside of work, and we've seen that happen quite a lot too. Now, obviously, we're not encouraging business to say you're not allowed to meet others outside of work. I mean, obviously, the current restrictions around household mixing are in place anyway, but as we start to relax up, those are some of the things we will see, you know, risks happening in as well. But more increasingly, we'll see them there because of people doing the right thing in the wider sectors as well. So, I mean, I've mentioned this previously before, which means it's not all about businesses, it's also about customers and islanders. We all need to work together. Islanders need to be clear about what to expect. So that's another really helpful thing as you're making bookings, making sure that your clients know what to expect when they turn up to your business, making sure that they're able to support you to do your best to protect yourselves, your staff, and other customers too. So, you know, we're not all good customers, are we? In fact, I'm a terrible customer. I think I've had to be reminded a number of times in shops that maybe not left enough space between someone else, because COVID sits in my work world, not always when I'm outside. So a business is doing a great job at trying their best to keep us safe, even when we become sometimes more absent-minded than we'd like.
Okay, thanks for that. And I'm sure actually you've got things to add to that as well, Caroline, in terms of that. It's easy to let your guard down when you're not serving customers.
It is, and unfortunately that's the practical examples where if we have had a positive case, either as a customer or as one of your colleagues, it's usually not that what you've been doing front of house that's been the problem. It is that literally the fact that as soon as you go for a coffee break or a cigarette break or travel to work together, that's the points where people have actually been falling into the definition of direct contacts. So something as simple as, how are your staff getting to work? If they're travelling together in a vehicle, there are things that can be done that changes the requirement from them being direct contacts to indirect contacts, which we may still ask you to go through testing, dependent on how much, if it's in a cluster, how virulent the potential impact is. But the difference is, in the critical parts of business, is that if you're an indirect contact, we're highly unlikely to ask you to isolate. That's the real difference between the two different things. So if people are travelling together in a car, wearing masks and having the windows open, or I appreciate that the wind and the rain tend to come in horizontally in Jersey, but little things like that actually do make that critical big difference to your business in terms of being able to have enough staffing. And it's only this week where a business has had to close, not because we've required it from a COVID risk point of view, but because they've had so many direct contacts within their staffing that they can't safely open. And it's a horrible feeling for us knowing that people are in that position, and there are things that you can do before that point, and challenge people that are wearing, you know, they're keeping the chins warm with the masks. If your colleagues aren't wearing it properly, tell them. And for some reason, not everyone seems to recognise that it needs to go over your nose and your mouth, and that your chin's irrelevant in this. That's just something to help keep it warm. That's kind of the key parts of that. And we do see people falling over again and again at these points, and that's where we have to direct contact trace them. And the other part as well is, it's miserable having to be isolated. I've had the joys of doing it twice now, and it's, you know, life experiences, I don't particularly recommend it. So if you can keep your staff happy, yourself happy, in work still open, it's the best opportunity for everyone. Mm-hmm. And we have a lot of people that have shared premises. If you've got other work businesses sharing premises, sharing a building with you, then talk to one another, make sure that you've got an effective cleaning regime and things like that going on across all of the communal areas. It's not a time to say that somebody else should be doing it. If you see it needs to be done, then, as Mark said, there's some really good quality cleaning products out there. There's also some shady quality cleaning products. And when Mark's come around with the little swivel testing kit, the difference in the ability to actually get down bacteria numbers is 100-fold easily on some occasions.
Delighted you mentioned the cleaning products. Delighted you mentioned masks on the chin. Can't believe that someone from Manchester talked about horizontal rain in Jersey, but that's fine. Well, Mark, can I just bring you in on one thing here? There will be the things that have just been mentioned there with regard to shared spaces, hallways, storage rooms, bin areas, places where your business might be great, but the other business that shares the communal area, and that happens a lot in Jersey. That's another area that people have got to think about and have a process in place for. And I just wondered, in terms of getting that kind of advice, that advice is readily available now. In fact, there's a team that are now going out from Monday to start in retail, but they're going to be available for the close contact teams as well, aren't they?
Yes, this team will be available to visit any businesses, any place on the island. They are mobile. As I say, we're starting tomorrow in St. Peter's. Thursday in St. Peter's. And this team are well versed in what they can tell you. But when it comes to what I have seen myself, Murray, is a lot of businesses are doing really, really well with the COVID. They've got a great risk assessment. They've communicated to their teams, and it's brilliant. It's that thing when they step through those doors that say staff. They go to the staff room. The masks come down to up there. I've seen them. And it's cigarette breaks and vaping breaks. That's where they stand together to talk. And it's, again, there's this nearness of the close proximity of people. And it's also, we've been finding, I've been going around with this machine called an ATP machine. It will measure the number of bacteria left on the surface. And a lot of the time is people are using the right chemicals, but or the cleaning chemicals. Some of these chemicals have a contact time. You must read your contact time details. And sometimes they're saying 3 minutes. It needs that 3 minutes to do the killing of viruses and bacteria. And we've seen a lot of time people just spray white. It isn't enough contact time, especially in staff rooms. The places we're finding are staff rooms, and you're really stymied wherever you go in the staff room. It's the door in. And a lot of people now that have a push plate on the door, a lot of people are putting their hands away from the push plate and putting a hand around the door to open it, thinking everyone else will be touching that push plate. So when you're cleaning things like doors, clean all around the area where the hand could go, inside and out. We're finding taps, fridge door handles, kettle handles, microwave door handles. And these are things I'm finding large amounts of bacteria. So these things must be regularly cleaned. And if you are sharing facilities, somebody discuss it with a company next door and decide how you're going to do this. Maybe stagger your tea breaks, your cigarette breaks, whatever. If anything else fails, call somebody like me in. The COVID team will come and assist. We'll come and give advice. We're there for to know how to make this island safe.
Okay, we'll send everyone the COVID email address, but in case you want it, it's quite simple. It's covidteam@gov.je. covidteam@gov.je. You can book. Any business can book a visit and they'll come round. They won't judge you. They'll just come round and help you and assist you.
Advice, pure advice.
Just good advice of things that you probably thought about, but just double checking. I want to go to the questions because there are now 10 questions stacked up in the Q&A. So for all 4 of you, welcome back. We've got Andrea, who's first. The new face mask rule. I knew this would come up for retail. The mask must be worn at all times in the workplace. Applicable to the close contact sector as well? Question mark. Is it applicable to the close contact sector? The face mask rule must be worn at all times, which has just come in or has been in for some time. But Andrea wants to know, is that applicable to them as well? Who wants to take that?
So I think that'd be me. As part of the workplace restrictions regulations, we brought in the various different rules that are required for mask usage. And yes, it is a requirement for all customer-facing staff to be wearing for customers. We know that we've applied a certain degree of exemptions to customers who may be unable to wear a mask for whatever reason. But the issue is that those exemptions don't apply to staff. And the main reason for that being is that we know that members of staff who might be in touch with and in close contact with members of staff, members of customers over, can spread infection unknowingly to large numbers of people, and for that to be spread and end up in community transmission. So yes, that does apply. We have had challenge on that from different sectors who've really struggled around people with disability that would otherwise, as a customer, be exempt from wearing a mask. I think the position currently stands that it is an issue. We're looking to support those businesses that might have people who, for whatever reason, can't wear a mask. We're in a meeting later on this afternoon with Dr. Muscat just to double check and make sure that we agree from a public health basis that it continues to be both proportionate and necessary for that requirement for customer-facing staff to continue to always wear a mask. At the moment, that scenario stands.
Okay, thank you for that. That was about as full and as conclusive an answer, but yes, it does stand. And also, can I just add delivery drivers, and I do this without any agenda whatsoever, but delivery drivers, we think of those in the supply chain going into retail or possibly going into hospitality, but supplies and delivery goes into the close contact sector as well. So the same rules apply there in terms of the safety measures that are in place for deliveries.
Yeah, so there's an addition that will be within the regulations now that requires any member of another workforce where you come into contact with anyone else from a different workforce that you're required to wear a mask. And that just means that we're not then sharing infection from kind of one setting to another. Because previously in back of house environments, there's a change coming again, because obviously we're making laws quite fast and sometimes there's unintended consequences we have to adjust. Currently it means that in some back of house environments you won't necessarily need to wear a mask, but if you are then coming into contact with from a different workforce, you're not physically distancing, then the mask would be required again in that setting, in that environment. So any visitor who is not a customer is effectively going to be from another workforce and will be required to wear a mask for the duration of their visit, and when they're working with and speaking to members of that other workforce. And that goes for delivery drivers as much as it does to someone coming to fix any of the plumbing systems or review any of your ventilation systems or whatever it might be.
Right, fine. Thank you for that. I want to move on because we have got lots and lots of questions, and we're halfway through already. So Andrea, thank you for your question. Hopefully that's answered your question there. Question from Rebecca, which I'm going to go to Caroline for, I think. As workforce testing is on an 8-week cycle for our sector, would you recommend cycling the staff within the business, for example, one staff member each week on a rotation to provide a staff sample, or would it be better to test all staff every 8 weeks?
I think there's two different elements. So with the reopening of the sector, that's completely separate to the 8-week cycle. If you wish it to be, that can be just specific to being able to reopen on this occasion as part of the wider thing. So if you take that out of it, you can get that outside of sync with the 8-week cycle. In terms of your staff force, there's potentially risk of getting them out of sync because you won't necessarily know what's happening in that period of time, get my teeth in. You could potentially find that you're repeatedly finding different individuals again and again and again. Equally, it means that it's possibly more difficult for you to manage from a time perspective in terms of knowing who's getting tested when. But then the plus side is that you've got a continual potential base level of knowing that at least you've got one person being done each week. If you get them all done at the same time every 8 weeks, it means that you do have that sort of full stop and restart again side of the business. But potentially you would find 3 or 4 at the same time. So I guess it depends on the size of your business, but also how closely people work together. If they're working quite closely together, you might find that it's easier to have that cycle over the 8 weeks. But if they are quite distanced, then just having a sort of snapshot in time every 8 weeks might work best for your business. So there's pros and cons to both ways. There's not a right way or a wrong way as such. But one is very much full stop, carry on. The other one, I suppose, is just multiple commas looking through as you keep going. If there's just the two of you, I'd probably just say get it done at the same time. At least then you know what's going on at each point.
I think the other point to add to that, as we were saying before, workforce testing, you don't have to wait for your 8-week cycle to come around. If this is in a week's time, go and get some testing done now.
The other side of it as well is that at any time outside of workforce testing is if you have any staff member that's symptomatic, and it's a growing list of potential symptoms now as we're getting to learn more and more about the disease conjunctivitis, which is not just a test to see if I can say it live, is also something that we've started to see on Ireland in the last short few weeks. It's about looking at those symptoms and asking them every day if their staff members have anything. What we now have on Ireland, which we didn't necessarily have back in the summer, is a really quick turnaround. So if you have got a member of staff who is showing symptoms and tells you before they come into the workplace, if they can get tested that day, the chances are they'll have those results before coming back into work the following day. So you're stopping it at the front door again.
Is that something that should be built into every start of every day? Right, how are you feeling? I know some places have a self-certification, a self-declaration. They have a form that they've got to tick off that says, I'm feeling fine today. I don't have any symptoms. I see Mark's nodding on this one. I think there's some agreement all around on this. Is this good practice?
Brilliant practice. We've put this into all the contact tracing offices now. Every member of staff comes into work every day. They're asked 3 questions. One is, do you have any symptoms, the main symptoms of COVID, which is the fever, loss of taste or smell, or a new persistent cough? Secondly, do anybody you live with have these symptoms? The answer to those are both no. Great. And then the third one is they have an infrared test. So it's literally non-invasive. It's about that far away from the forehead. They take a temperature. If your temperature's below 37 degrees, that's a really good sign. And we record this, that these people are okay. And we do this every day. It's a great way to test your staff and ask them if everything's okay. And if anything isn't okay, then I would say to them, just let us know before you come to work. We may ask you to go for a test. And it is the cough season and the sniffle season, so it's always be on the safe side.
Okay. Have you seen the temperature camera that you can have at some stores? So you face as you come in, about as far as I am from the screen almost. No member of staff has to do the testing, and it reads a temperature of each member of staff as you go in. So those are available on Ireland now. A good thing?
Yes, yeah, anything like that. We use a little infrared thermometer here. It just literally is about 6 centimeters long, and it's very, very cheap and can be bought on islands from almost anywhere. And literally with infrared, as long as the nearer you get to it, the better. So within about, say, 3 or 4 centimeters, it's a great one to tell your body temperature.
We're getting lots of good safety tips on this, and I've got loads of questions I've got to get through. Says Agnes, I'm a sports massage therapist and I work from home. I have a dedicated room for massage treatments and also a separate bathroom. What guidelines working from our own home would you recommend clients would sign a disclaimer in being treated in a private home? So what guidelines are there? A disclaimer is the second question. Also, are there any laws regarding working from home during the COVID-19 restrictions? What advice for Agnes do you have there, Martin?
Okay, so I think we've covered in the guidance. I'm just trying to double check if it was in here, if it's in the standard guidance. The visiting people's homes to provide services. Effectively, we don't necessarily encourage visiting, actually running. If your business places you in your own home, it becomes a lot more complicated. And at this moment in time, as we're encouraging people to not be working in other people's homes as far as possible. I hadn't really considered it, if I'm honest, from the basis of working from your own home, if that's your business place and you have all of the protocols in place to make sure that you continue to be as safe as possible. Effectively, that is your workplace, and that would be considered your workplace in law. So from a legal perspective, I would advise another email address is workplacecovid@gov.je, which is the Health and Safety Inspectorate team. If you have any questions about how the law applies, that team are specifically there set up to support businesses to ensure that they're working within the law. So that's probably a detailed question to that particular sector. But as far as I'm aware at this point, obviously, I think the main advice would be making sure that any aspects of the business whereby you're having customers come into that business is that those, as far as possible, separate from the wider living accommodation and other householders.
Okay. Anyone else with anything else to add to that? No, otherwise, yes, Caroline.
Yeah, that comes down to, and it just very quickly tips on to the end of what Martin said about other householders. You don't know the health status of the individual that's coming into your property, so it's about making sure that you're protecting the people that you care about, and making sure that you've got that effective cleaning understanding in between clients, and if you know what time somebody's going to be coming home, making sure that they don't cross in your hallway or anything like that. So that's the other key part about it, and it comes down to cleaning and hygiene repeatedly.
Great. I've got face mask questions coming in here. Christian and Mar with questions similar. Mar says, are face masks needed in conjunction with a visor, or is one or the other sufficient? That's one question. And at the same time, Christian said, safe opening checklist does mention staff can wear masks and or visors. In a salon environment, we understood the rule change to be to state that all staff had to wear masks, not just a visor. So masks and or visor, or masks and a visor?
I can answer from a contact tracing point of view, which is slightly different to the legal compliance element. If you're wearing a mask and a visor, and this is something that was introduced into schools, you will see, and obviously our number of direct contacts in schools prior to Christmas was significant, to say the least. And post-Christmas, we've been able to reduce them right down each time. And a lot of that is about the use of conjunction of both the face mask and the visor from the teaching perspective. And if somebody's had both of those things on, we're quite confident that their number of direct contacts is going to be really limited. If it's just a visor, what it doesn't do is prevent the wider spread of the droplets. So if you're in an area for a long period of time, it makes it far more difficult for us to have that confidence that the people around you aren't direct contacts. So that's not necessarily the law. That's the that's how to protect your team and yourself from becoming a direct contact.
Okay, Martin, do you want to pick up on this? Where are we in terms of the law on this?
Yeah, well, I think as Caroline has said, the requirement of the law is that you either wear a mask and or face shield. I think Caroline's advice is very much stands. If you want to protect yourself as far as possible, using both a visor and a face mask is advisable on that basis. But we do know, in some environments, we know that obviously that a visor will also reduce the amount of face touching that you do, and then putting kind of like for then creating kind of touch points and spreading the virus. So you need to be aware of that from kind of like a mask point of view, which then reduces with a visor. The other issue here that would be helpful is it consider raising, and when we look at some of the UK guidance in close contact services, they will sometimes use both a combination of masks and what they call goggles, which isn't in our law, so we haven't put it into the guidance. But interested to hear back from any colleagues on issues like that, if it's something that we need to take into wider consideration. But effectively, yeah, a visor and a mask would be the safest option.
Right, okay, thank you for that. Question from Chris, which is outside, or not quite outside of that, but are clothing alterations and tailors considered close contact or non-essential retail?
Okay, considered by who? I mean, I think this obviously quite a challenge. They have been, I think, to be fair, because they would sit some of those services within retail environments, they will have been opening alongside the non-essential retail environment. I think, and then we all have in the various areas guidance on what you would do if, for example, you need to, for short periods of time, need to come in, you can't maintain a 2 metre distance between yourself and a customer, and they would need to follow that guidance on that basis.
Okay, all right, fine. Thank you for, I think, answering that one. Follow the guidance, and you could probably fall into both camps on that. Rebecca says, when can we see the updated guidelines? Rebecca says, haven't received it yet. I thought I'd sent them out a little bit earlier on, the draft. I'll make sure that goes out again. and we're likely to see these very soon, aren't we? I mean, they get signed off presumably next week sometime.
Yeah, I mean, effectively, we like to make sure that they're out and available before opening as far as we can. It's not often as, as fast as we'd like when things are done and move forward in terms of ministers' decisions. But I think what I will have a small pause. I think what we'll do is we'll make sure that they're available from Monday lunchtime as an online version. And that will just allow us, where there are sensible and practical kind of options come through from stakeholders to say, actually, this is not practical, or could we consider this, or the goggles issue, for example. That might be something we'd have to do later because it would mean a change in the law. But we're open to kind of aspects. We think we've got the guidance right. The guidance is over and above what we previously had, and we hadn't received any additional comments from the sector saying, actually, you should do this differently or that differently. There's some additions in there that are sometimes kind of optional and where practicable. So we know, for example, in the UK, in close contact, they're saying, as far as possible, you should provide screens between customers where in static environments. So, for example, in hairdressers, but we recognise that in not all scenarios that's going to be practicable and affordable. But putting those additional options in whereby businesses are able to make changes that offer additional assurances and infection breaks for customers.
Okay. I'm aware that we've got 15 minutes left and I've still got quite a few questions to go, so we'll get through these best we can. The question that came in beforehand from Rachel and Rebecca was, what area of our operational services, and we're talking of this sector, do you consider to pose the most risks to ourselves and our clients? And what data do you have on how many cases and clusters in the island's hair and beauty industry have been responsible for, with as much detail on the types of services as you've got? So whatever data you've got and where the clusters came from and what are the big dangers. Caroline, please.
I might go in reverse order. So in terms of cases since March in the industry area, we've identified 9 that were linked back to hairdressers, none that were linked back to barbers, salons in that industry. Apologies, but I've not got the breakdown of the link with other beauty suppliers. That was what was able to be pulled out in preparation for today, just doing a look at the different sectors. So to me, it's the key risk of spread. It's twofold. If it's particularly virulent, it's both the contact, the touch points, the physical contact, and not being able to clean it either to a high enough degree where it's killing the virus, or frequently enough that it's not being in between. And then that's down to individual. It's really difficult. We're built to touch our faces. I find myself having to sit on my hands so that I'm not a hypocrite. But it's a really natural thing to just, scratch your eyes or, whatever we do, and to have that then hand-to-mouth contact. And that then leads to potential COVID if it's the particularly virulent strain. So touch points are a critical area, a critical risk area if we find that there's a cluster associated. And the speed that can move around, we've found, 25 cases linked back to one specific premises. So it can be quite significant very, very quickly. And the other part is the close contact, and that is the 15 minutes. That's the evidence kind of barrier. So 15 minutes of being within close physical area of an individual that's got sort of normal levels of COVID. That obviously changes dependent on if one of the more virulent super spreader strains. But in the most cases, it's about that close physical contact. So if you're working on a hairdresser's, and I appreciate that different lengths of cuts take longer or shorter to do, but if your average case is at least 15 minutes, then you know that that's a potential particular risk area. The same with if you're doing facials or anything like that, you're within that distance for that sort of risk period of time. So they're the 2 key areas.
Right, thank you for that. Mark, do you have anything to add to that before I move on?
Yes, I do. And when you've we haven't mentioned this yet, but when you have taken your used PPE off, and we recommended time is 2 to 3 hours for a disposable mask, although basically if it becomes damp or dirty, it should be replaced anyway. The key thing here is also to dispose of it properly to a sealed container and then sanitize your hands again.
Thank you for that. Good advice and something that we hadn't considered. Something else for you, Mark. Can you just repeat the EN number for the disinfectant? You mentioned it before, and
yeah,
we'll get it to everyone afterwards, but if you can repeat it, that would help.
Yes, Echo November EN 14476.
14476. EN 14476.
Yes.
I'm good with numbers, so I'll try and remember that. 14476. Interestingly, if you want to book the one number I do know, 445566, is the contact tracing, not the contact tracing. It's the workplace testing. Right, so that's Agnes's question answered as well. One that's coming from Sam and said, thank you all for your time today. We appreciate you being there as well, Sam. Thank you very much. I wanted to understand the decision to delay the close contact services a week behind non-essential retail. Sam says, as a practitioner who works under the Jersey piercing and tattooing law, adhering to strict hygiene and infection control procedures all of the time, not just during COVID, utilising health questionnaires for every client, automatic trace details upon client booking, ensuring we know exactly who is walking through the door. I'm aware many of us are confused that we are branded as higher risk than a retail shop who could potentially have no idea who's walking through the door and no control how distanced their customers are. That's a good question, actually, Sam, and one that I think we've seen a couple of times from various sectors who've said, no, we do this for a living. We know what we're doing. Why are we down the queue to other people? I don't know how short we can keep this question because we've got lots else going on there. Martin, you've taken a break for a minute. Let's go to you on this first.
I think this is probably one of the most difficult questions that we get asked and one of the most common challenges that we have. I think when you are managing a pandemic environment and you need to respond quickly and at speed to ensure that we're protecting the public, and you're dealing with a whole raft of all sectors, there will always feel like there will be some inconsistencies and some unfairness. And in some cases that is, there's greater gaps between those and others. What we do is we do look to do our best to identify and rule whereby additional risks can come about. So one of the things we will do is we're looking at sectors as thinking about what is the touch point risk? What is the level of close contact and the point of contact, the number of customers? What is the air environment? How contained is the environment? So we look to a number of different environmental factors and consider kind of what the risk might be, what mitigations might be able to put in place. We can't always guarantee, obviously, those things are put in place when they're only by guidelines. So we're looking our best to kind of understand and look to stage reopening and sometimes closing as well. So we try and balance the harms as far as possible. So when we're looking to reopen, we're looking to reopen as safely as possible. We don't want, one of the things we're looking to do at the moment is we got the opportunity provided by vaccination. Now we've still got a lot to learn about what might happen, but it's looking very much like that we're going to have parts of a higher risk population that are going to be protected from most severe disease and death. So as we move forward and get that population, we're protecting our public, but we might still see some transmission coming out of that. We're looking to get ourselves towards this window, avoid any spikes, avoid any backward traction. So we can't open everything at once. So that means that our ministers under medical advice have got really difficult decisions to make. And those meetings often are long and late.
Yes.
And end with dissatisfaction, and I speak to a lot of colleagues around dissatisfaction and misunderstanding, so I smiled at the end there and then kind of catch myself feeling guilty because I know it has a significant impact on a lot of people, a lot of people's livelihoods, and islanders that want to access these services as well. There's a lot of frustration, but we're all doing what we can as an island, I think, to work towards a safer future whereby we can start to get back some of our freedoms, where we can see other sectors open. We want to be able to see, You know, we want to be, some of us will want to be able to get back to our indoor exercise, into our gyms. Some of us will want to go to families just to sit down and a cup of coffee in a cafe. Why not? Why shouldn't we? Well, we're trying to do that. We're trying to work it out. We're trying to make sure we do that in stages and as safely as possible. And I doubt there will still be some dissatisfaction as we move through that. It's almost inevitable, and you know, but not intended. We're trying to balance the risks against economic and well-being harms that we know that this awful international scenario is caused us all.
Okay, Martin, thanks for that. It was a good answer and a good question to go with it. Thank you, Sam, for the question. Someone says, could we have the symptom employee form sent to us? You talked about symptoms and the questions you get asked as you come in, and a symptom employee form. Is there such a thing? And if there isn't, can we have one?
I mean, I like the other guy's answer, but if you go to gov.je, the list of symptoms are up there on gov.je. We've got some good advice in terms of what you then need to do. Yeah, so, and I think, but it's good about sharing practice, and we're seeing different places share practice in terms of those scenarios, and people are using, as you say, checklists to make sure that people are not coming into work with infection. So I don't know if Mark is able to share anything there, but I'd say to everyone, gov.je has the overview in terms of symptoms and how to respond. Okay,
Mark, anything else to?
And I've got a form. If people want a copy of it, I'll send it to you, Murray. You can send that out to them.
I'll send it out to everyone. That's great. That tick done. Thank you very much indeed. I like that. Sarah, and I'm not quite certain I get your meaning here, but I'll stumble through the best of it. Are the exemptions for people from wearing masks the ones that they do themselves on gov.je, on the gov.je side? An exemption from wearing a mask. This is a complicated area, and I don't want to waste too much time on this, but where do people apply for exemption?
Yep, so you're right, Murray, it's on gov.je. There's an exemptions page, and it is self-assessed on the basis that that's the best way of doing it, when we know that some people feel that they do get fear and distress from that kind of close, contained kind of feeling. Some people with certain conditions, and distress is something that our medics might have a view on, but they're not able to kind of assess. It's assessed by the individual, but that is for customers only. If you are a customer facing member of staff, those exemptions don't apply. And then I appreciate in that there might be challenges here for some of the smaller businesses, but looking to for staff who are unable to either wear a mask or a face shield or both, that they would need to then consider kind of placement in a different part of the operation of that business.
Okay. Tanya, I think you half asked a question and then it stopped. So Tanya says, as a beautician, should I have all my clients, and then it stops, but I think, should I have all my clients tested? Should my clients be tested before they come to me as a beautician? I don't know if that is what you are asking, but let's assume that is. Caroline, what do you think?
So at the moment, the testing scheme is open to the workforce, but not to visitors. One thing that you can do before tests, before any appointment or anything like that, and people that I've been to also utilise this, is to actually ask the person to self-declare beforehand that very much like, well, pretty much exactly the same questions that you ask staff members, and the form could probably be adapted for that, checking that they haven't got any of the symptoms, again, that nobody they're living with has got the symptoms, and that you've got a system in place whereby if someone does ring you and says, actually, I don't feel great, that you can be able to stop them from coming to you and to look to rearrange that way accordingly. If they are symptomatic, and that's the difference, if they are symptomatic, they are entitled to a test through gov.je, through the helpline. So if you wanted to advise them that they can get tested as a symptomatic person, get them to call 445566. If you've got availability the following day, chances are they'll have had the test, they'll have got the result, and they can come back and have that appointment the following day.
Brilliant, thank you. Anita says, I'm a nail technician. I wear glasses and I've tried to wear a visor too. However, my vision feels distorted, so I cannot wear a visor at the same time as wearing glasses because I'm doing something which is quite detailed on nails. Also, the problem with a screen between the client and the technician is there has to be a large opening at the bottom for the hands to go through. I'm miming this as I go. I'm doing international mime for nails. Not that I know anything about it. Also, it means that there is an extra item to be sterilized between the clients, so not really worth it. Is it better just to be wearing a mask? Long question.
Yeah, the short answer, I'm afraid, is that it comes down to your personal risk assessment, going through each of the different areas and looking at how you eliminate the risks associated with that. If you are going to use the screens even with the gaps, then yes, it is something else to sanitize. But then equally, you can have the different contact time sprays. So some of them are as effective as being able to spray and wipe, so it's not a massive impact. Some of them can be 3 minutes, and some of them you actually leave on for 20 minutes to let it dry naturally. So if you've actually got a gap between clients, you can spray it, just leave it, and you don't have to do anything more with it. So there's different products that can help you with that.
Sorry, the screen is principally there to capture particulate matter leaving somebody's mouth. That's the reason. So
yeah, so that's into what do you do with your client? Are they wearing a mask? If they won't wear a mask, how are you mitigating the risks in those circumstances? So mask wearing of the client is, it's part of your control measures that you can introduce where it's appropriate in that respect. And that can then link in with how you wear your own things. So if you can't comfortably wear a visor, one of the things you can do, there are different visor types out there. Some of them are actually designed specifically to sit on top of glasses, but I appreciate that looking down and doing the work there might, sorry, I'm doing my little finger pianos, that might actually impact on your ability to do the job. So it's experimenting with the different side of things, because you've got more than just COVID to balance. You've got to also have happy customers, and if you've painted the cuticles, that's obviously not going to help and assist you in terms of keeping that relationship and that side of the happy thing. So if you can't use a visor and do your job, what's the alternatives that you can do? Is a mask sufficient for you if you're getting them to wear a mask as well? Is the partition sufficient? So it's unfortunately, and nothing with hygiene is ever that easily black and white. There are different ways that you can accommodate it, and you just need to think about what's going to work best for you, and remember what you're trying to do, which is to try and stop the spray of particulate matter and to prevent the touch points becoming a source of contamination. That's how it breaks down.
I know again, Murray, but I would just ask if someone like Beverly Laquiro would take views from that sector. I mentioned about goggles earlier. It would seem to me that maybe goggles might be a solution. That we'll take that to Dr. Muscat to consider. That might be a different option, but we need to just double check and look at the protections that are offered from that as well. But if that's something that that particular professional group beauty sector might be interested in, no thanks, I don't want to wear goggles, but something we could look into.
Okay, you're going to look into goggles. I love the idea of that. Mask wearing has been mandatory in our salon, says Anita, by the way, since the 12th of June for both staff and clients. And by the way, I love all the miming you're doing. See, these are good people who really appreciate your skill and your artwork of piano playing with nails. And that's, I think we're almost out of time, with the exception of Manuela, who says, with regard to the attached guidelines, acupuncture, I never can say that right, acupuncture is under a different set of guidelines, it would appear. Do we have the guidelines for those doing acupuncture?
So yeah, acupuncture has been included underneath the guidelines for registered healthcare professionals, recognising that they kind of fall between professional groups to a degree, but because of the nature of their specific kind of healthcare contribution and the actual kind of process of acupuncture, they're required to have the proper PPE requirements. They've been included in that guidance and should be working to that. So you'll see when you go to the healthcare professionals guidance page, acupuncturists are included as professionals that need to work to that guidance.
Thank you. Good. We are at 2 minutes past 2. We are out of time. We've you can see from that sector. Quite a few questions in there. In terms of takeaways, and I know, Martin, that you said right from the very start, what we want to do is engage with the sector as much as we possibly can. And between yourself, Mark and Caroline, I'm assuming that you want to hear from this sector of anything that you could learn from those who are at the, I don't want to say the coalface, but right at the front end service of customer service here. So it's a learning process for you, isn't it?
I mean, I think found is actually as a lot of the workplaces helping one another. As we've done some of these, some of the sessions we've done, some of the key stakeholder engagement, people are sharing various different approaches that kind of, we found this really helpful in terms of working within guidelines. But the guidelines have been released as a final draft. They still say draft on them. We think they reflect the kind of what is required by the business to try and keep customers as safe as possible. Yes, they are guidance points. There are aspects of that guidance in terms of masks, which then are transferred into law. The collecting of personal contact information is transferred into law. But effectively, they represent, we believe, some of the key things that the sector should be considering planning for to keep customers safe. If there's anything in there that you feel that will benefit others, or are concerned about or any issues, yes, we're happy to hear those, because we don't want to set anyone up to fail. But as I say, I think they are on reflection. They're not too dissimilar to that we discussed with the retail sector, with some specific areas for the sector. And I think that's what you will see. So if you look across different guidances, there will obviously be a lot of things that are shared amongst different places, then with some specific things for people to be considering. So we hope they're realistic. We hope they're achievable. If you're able to work to them, they certainly will protect the public. But if you have anything for us to consider in reference to that, yes, happy to hear.
Thank you, Martin. Caroline, you were about to say something along those lines as well. This feedback's important.
It is, absolutely. And it's a cheesy phrase, but it's true. And this is all elements of what we're doing. It's about the practical application of the policy. If policy has been created and it can't actually be done within the workplace, or it makes it unsafe in other areas, it's absolutely critical that we know about this, so that we can work with you to come up with something that's workable on both sides. We certainly don't want to be trying to force you into situations that you can't achieve. It's not fair on you, and also it's potentially unsafe, and it's completely counterintuitive to what we're trying to achieve ultimately, which is to keep you open and keep the health of the island as much as we possibly can do safe from the effects of COVID for that. And one critical takeaway piece from risk assessments, PPE is always the last part for us when we're going through these things. If you can do things like spacing out and such, it's always about how you can apply the risk assessments that you used to do in other areas to this, and just making sure that you just keep reviewing it and keep checking in with your staff, and making sure that we don't make that horrible phone call, which when you're on the receiving end, and in my case, one of my colleagues rings me up and says, can I just check your name and date of birth? You know that you're going to end up having to isolate, and it's not fun, and you don't want to do it. So that's ultimately what we're trying to do, trying to stop you becoming a direct contact.
That's what DC stood for.
Sorry, yes, it's nothing to do with Marvel Comics or anything like that.
I saw that in the email and I thought, I must ask you, you don't want anyone to become a DC, and I'm thinking direct contact. Now I see we're in codes, but we know it. Final word, I think, is with you, Mark, now, because your teams are going out and have been going out with retail, and now with close contact, people can book them. You're there to give people advice.
Yes, just keep the island safe, keep people safe, and they're going to advise. And if they find that a situation is fantastic, they'll tell them. But if they need advice, they'll give them advice, and it's free.
Great. All right. Listen, we are way over time. Thank you to everyone for their questions, for watching. This will be up on video probably in about a day's time, the way my internet's working today. By the time I've downloaded and uploaded it onto YouTube, but with all the guidance will be there, and we will, of course, push all of this this information through to all of you that have been watching, in terms of all of the links and all of the phone numbers that we talked about today. Caroline, Martin, Mark, thank you very much indeed. Have a great day. And for the rest of you, good luck with the opening next week. Fingers crossed for all of you. Thank you.
Yes. Thanks. Cheers.
All right.